Hi everyone.
Kia ora, Kate.
Good afternoon.
How are you?
I'm all right. I'm okay. A bit croaky. The dreaded lurgy finally hit.
Yes, it did. No good. How are we going? 32. It always feels deathly silence when we're all coming in, doesn't it? It's good to see some familiar faces here, familiar names.
How many are you expecting, Ro, on this session?
We've got 50 per session signed up, Kate. So small enough to allow people to put their hand up and speak and ask the team their questions. So first session went very well this morning, so that was really good. Great. And we encourage everybody here to not be shy for sure. The team are ready to answer your questions, and yeah, there were some good questions this morning. Well, this afternoon we did start at 12, didn't we, team? We're now at 2. Yeah. Forgetting my time. It's crazy. The day's just racing by. So we'll just give it a couple more minutes, shall we, Liam? And then we'll get started with everybody. You always hope that everybody turns up to these things if they put their name down. Isn't it funny, if we were all in person, we'd all be chatting away. There'd be a hum in the room, deathly silence as we come into virtual. We will get to do some in-person workshops before the end of the year. We're determined, I think, aren't we? Be nice to catch up. Okay. All right, well, welcome everybody to the second session of the Hira Onboarding and Certification Workshop. Corel Jensen Tukawangoa. I'm the CEO of the newly renamed NZ HIT to the Digital Health Association. And we welcome you all to this open forum with the Hira team. I'm going to be soon handing over to Sandra Horsville, who is our program, or is the Hira program lead for engagement, and she'll introduce what the plan is for today. Just to let you know that it is an open session, please feel free to put your questions in the chat, and as well at the end, make sure that you put your hand up and ask some questions. The team are here to do that today. So without further ado, I'll hand over to you, Sandra, and yeah, enjoy the session, everyone.
Thanks, Ro, and welcome everyone. This is our first session with everyone post-Christmas. Excuse me, we did a webinar prior to Christmas. Always away. My throat's now gone a bit weird. Sorry. Sorry for doing that in your ear. So as Ro said, I look after the engagement part of Hira, and with me today we've got Patrick Haimarsh, who is our product director for Hira, Vidya Makam, who's our Data and Channels Program Lead, and also Peter Marks is beside me, who is our Technical Director. And so Peter and I will be posting some questions into the chat. It might take a little while for you to kind of respond on the chat, but please use the chat to ask questions as you go through. We want to make this as interactive as we possibly can online. And our whole, if we just flip to the next slide, our whole part of the reason why we want to have this engagement with you is really to test some of our ideas with you around certification or onboarding. What is it and why are we doing it? But also bearing in mind that this isn't set. So this is part of our engagement with you, is to find out what your challenges are, what you see is missing. These are some of the questions we'll pop in the chat. What you see is missing. What do you think is your organisation? You know, how well do you think you're placed for these? Do you think the bar set too high? Do you think it's too low? And we want to get feedback. So we'll develop this process as we go along, and we'll come back to you, no doubt, in probably six to 8 weeks' time with maybe version 2 and what that looks like, and get your feedback again for that. So we want to make this an iterative process. This isn't us just saying, here's the process, this is what we want, but we want to make sure it works for you, because otherwise, if it doesn't work for you, then Hira won't work at all. So we're going to kick off with a review about Hira, just for those who didn't attend the December webinar, but we won't spend too much time on that. We want to get through the rest of the session, and then we're going to open it up at the end for questions and a bit of a Q&A session, and just have a bit of a discussion. So I'll hand over to Patrick.
Cool. Thanks, Sandra. Kia ora, everybody. I'm Patrick, the product director, as was mentioned. So yeah, just a bit of a background on Hira for those of you that might not or might be new to it. It's previously been called NHIP, but recently we've, with consultation with our Māori Health Director, we've chosen the name Hira to represent what it is we're here to do. So Hira is a Te Reo Māori word, means to have significant bearing on future events or a widespread effect, which we all hope to be true. And our primary purpose here, or at least what we're here to do, is to bring together a person's health data into a virtual electronic health record. Virtual being the operative word there. We're not trying to create a giant database in the cloud full of people's health information. Rather, we're a connector, or we provide connectivity between the data sources and the people who need to use them, and provide a standards compliant interface into that set of data. So we want to do that to be able to put New Zealanders in control of their health information, and allow them to participate more fully in their healthcare journey. This information we want to make sure is available in a timely fashion to the people who need it when it's needed, and get visibility over give consumers visibility over who's using their information and for what purpose. This means we're going to need to work really closely with a lot of people involved in the health sector, consumers and providers being obviously key customers, but it really is pervasive across the entire sector, and in fact ultimately across the whole country. So that's kind of what we're here to do, and today we're really here to talk about the certification onboarding process, as we've talked about, and so to sort of set the scene for why that's important for us. The way that we're looking to deliver, or what we consider the product that we're here to do, which is the thing that I'm looking after, we define this as sort of as a Hira information service. So the service is defined as comprehensive health information as a trusted, personalised, user-centric service for all New Zealanders. This service is something that we'll look to, as I said, look to establish by connecting to data sources that hold information across the health sector, and make it accessible through a common information model and a common set of rules for how we can access and use that data. So that's important. You know, the important distinction there is that we're not looking to hold information or manage it. We're looking to make it so that it's accessible and usable by lots of different people, particularly those who don't currently have great access to health information, and ultimately make that simplified access as open and accessible as we can make it, for individuals and whānau, community groups, hauora providers, researchers, and of course the wider health sector in its entirety. So a core component of developing the
Patrick, we've lost sound.
the information service, and we would like
You've come back now.
okay, my apologies.
Okay.
Do I need to
Good.
rewind a little
Yeah,
bit?
just
Ro?
go back. You just rewind a little bit. Yeah.
Okay, so I'll start from this slide again. Does that make sense?
Yes, sounds perfect.
So the information management approach that we're looking to do here is to really define what the information is that we have, how we describe it, what the attributes and relationships are between that information, and then of course also the standards around how we represent the information within that model. So what coding standards we use, and the taxonomies and ontologies for that, in a nationally consistent and ideally, to drive interoperability across the health system. So that model will then be used to help define the different use cases for information across our different customer groups. So those views are really about who can use the information, how will they benefit from it, what purpose would they need it for, and what information do we also need to be able to contextualize the use of that data for audiences that aren't currently really that well served by access to information. So when you think about health consumers, for example, just pulling data out of a PMS system and putting it in front of health consumers might not actually give them any value. And so we need to work out how we make it useful for consumers in that context. So once we have those use cases, we're then going to look at how we can create governance and policy around its use. So what are the rules and the limits around how that information can get used? What obligations do people have around keeping it safe? How do we manage consent and permissions and social license and expectations around data use? And most importantly as well, how do we provide transparency and accountability over its use? So how can consumers get a view of how their information is being used and managed? And then obviously the last piece, which is almost one of the most important pieces, is also how do we then find the data that we know exists and consume it up into this service so that it can be made available to those who need it in that standards compliant or standard interoperable format. And so a part of this, obviously a part of the information service, is how we manage the risk of this and how we maintain our social license. And so we're looking at also developing a risk-based assessment framework that sets out the rules for access to information. And that needs to cover 4 key areas. There's identity management. We need to know who you are and what organization you might represent when you're accessing information. What consent and permissions you have to access the underlying data and who you get that permission and consent from, whether it's the consumer or some other authority. How do we provide that transparency and accountability over that information so that people can be confident that it's being used appropriately and in line with their expectations? And those 3 things really drive the 4th section, which is social and cultural license. So how do we ensure that we maintain the public's confidence in our ability to operate this service and make sure that we're doing it aligned with their expectations? And so the way we see that is by looking across the classes of information or the types of information that we have, from sensitive information, as it's shown on the left here, which requires a lot more assurance, a lot more work. We need to do quite a lot of due diligence and assessments and reporting on the use of that data, because that information is obviously a lot more sensitive to people. They have a lot more attachment to it, and there's a lot more risk of undermining public confidence if we get that wrong. Right the way through the spread, all the way up to things like metadata and other transactional information that's not really personally identifiable. Still requires us to make sure we're looking after it properly and we're assuring its use, but we could have a more high trust model that's got more automation involved. And so our assessment framework needs to look at the spread of those things, and Vidya's going to run us through some of the thinking we've done around how we would manage and create that process. And so this is where I will hand off to Vidya and she can run us through where we've got to from here.
Thank you, Patrick, and hello, everyone. So before we deep dive into the process that we've kind of started off with in terms of and where we need your input, I think it's really important that we all understand why we're doing it. I think, as Patrick said, Hira is an information service, so we're going to share information about the consumer with everyone. So we need to make sure that we have continuous assurance in place and that we can make the process can make sure that we reinforce the trust and provide confidence to people. We need to make sure that organizations that either providing data or using the data have appropriate controls in place. We need to make sure that the data standards that Patrick talked about in his information model is adopted and it's consistent across the system. We need to make sure that as we scale the Hira information service, that the process that we put in place can actually operate effectively from day one to the future. And obviously, we need to have effective support pathways in place so that people can get help as they go navigate through the process. So, in order to achieve those objectives, we've kind of thought about some guiding principles as well. So obviously, because it involves people's health information and well-being information, we need to take a risk-based approach. But at the same time, we need to make sure that the process is right-sized. We can't make it so hard that people can't navigate through it. And we also need to make sure that we have appropriate support is in place so that we can help people work through that process. We need to make sure that the process is transparent and easy to understand. People know where exactly they are in the process and what they need to do to get from that step to the next step. And obviously, we need to take an end-to-end view so that we don't ask people for the same things over and over again, and we can kind of take them through the process as simply as possible. And obviously, we all know that there are certification onboarding processes that exist now, so we need to learn from them, leverage from them, and reuse the work that already done, so we don't end up creating yet another process that we all have to go through. Most of you, we believe, will interact with this process as either as a data consumer or a data provider. So either you're currently custodians of data that Hira information service will access and make visible, or you would want to consume data that Hira information service will make visible to you. Before I go into the next steps of the certification onboarding process, we want to kind of talk to you about the input that we're seeking from you. As we go through the process, we'll go in detail the steps we believe we're going to be, the certification and onboarding process will contain. And we want you to think about, do these steps make sense? Are we missing something? How ready do you feel your organization is to participate in this process? What kind of support do you think you'll need from Hira to go through this process? Based on your experience and expertise, do you think the process goes too far, or does it not go far enough? Do you think it'll help reinforce the social and cultural license that Patrick talked about? This is a high-level overview of the certification process as we believe it should hang together. So I'll go through each one of these steps in detail. The first step is actually understanding who you are and what your interest in Hira is and how you want to interact with the process. Are you going to be an organization that's going to provide data, or are you going to consume data from it? As part of it, we might ask you to complete a declaration of use form. The purpose of this form is to understand the level of risk that's associated with the data that you're either going to share or consume, so that we can make sure the next few steps are tailored according to the declaration of use. The next step, or one of the other steps, would be the security and technical review. The purpose of this review is to make sure that you have good security practice in place, but also to understand what your adherence to the technical standards that we want to put in place is. You may need to demonstrate compliance with the health information security framework. Collaboratively, we need to understand the risk associated with the sharing and accessing of the information that you're interested in. If you're a data provider, we might ask for other things like availability and performance and other non-functional requirements that you might need to provide us with evidence with. And obviously, cybersecurity will become a huge part of our virtual health information service. And so as part of this, you may need to provide independent audit reports or provide external pen testing so that we can go through this process safely. The next step in the process would be privacy and data use review. This is to make sure that we have steps in place to safeguard the personal information that we're going to access and share widely. Good privacy obviously enables the person to control the data themselves. And therefore, as part of this, we want to make sure that you understand how the data that you're going to share or consume is going to be seen and how the consumer would see that sharing of information. So you might want to include plain language privacy statements that outlines how the data is accessed and stored and processed and transmitted. You might need to have to complete a PIA, or you might have to demonstrate compliance with the information management framework that Patrick talked about. And all of this is to make sure that we can continue to deliver to the commitment to the transparency around the use of data, and that the health consumer can feel that and be confident that their data is safeguarded. Patrick talked about the data model and the standards that will become part of the information framework. Hira relies extensively on making sure that all this data that's coming together is aligns with the standards, and everything that is captured and shared means the same thing. So as part of the certification and onboarding process, we will go through a data quality and adherence to standards kind of review to make sure that you're aligning with the standards, which might be FHIR or national code sets or other standards that are either already in place, are being developed, or may be developed as part of this process. You might have to show how you're going to map any local code sets that you hold to the national standards. As part of this, we might come upon some gaps in the information model that Patrick is developing. And we might also have to define some standards about how this data is presented, so that irrespective of who's viewing the data and the system that's presenting this data, the data is understood in the same way by everyone. As the outcome of all these different steps, we may end up with a contractual agreement that captures all the schedules that we talked about, some commercial arrangements that might be put in place, SLAs to make sure, especially if you're a data supplier, to make sure that the data is available, non-disclosure agreements, and we might also agree some review cycles so that the compliance check is not just at the start, but it's continuous, so that we can make sure that it's a continuous assurance framework is in place. So if we go back to the beginning with what Patrick said, everything that we need to include in the certification and onboarding process is to make sure that we continue to maintain trust, confidence, and ultimately support the social license to operate and share this information. We have to tailor this to make sure it meets both ends of the spectrum, the sensitive information to the metadata, to the anonymized information. So that's going to be the key goal of this process. So I will hand over to you, Sandra.
That was a very high-level view, and I know that people will want to know more detail. But we want to ensure that we capture your feedback, and the questions coming through the chat are great. So keep them coming, and we're going to open it up in a minute. But the main thing, as I said earlier, is to get your feedback. We want you to help shape this with us. We don't want this to be the bar too high or the bar too low. And there'll be questions that you'll have afterwards that you want to share. So we've got our email there, contact at Hira. So send us your questions and comments, and we'll get back to you. And also, like we did before Christmas, we published earlier this year, because we received quite a number of questions from those webinars. It was almost a couple of hundred. So we've had to go through and answer all of those, which was great. It's helped us really shape some of our thinking too. And we want to be able to provide more feedback on these questions as well. So we'll shape all 3 sessions. We'll gather all the questions up and we'll publish them, as well as answer them clearly. So this is the beginning of the process, not the end. We'll have more opportunities to work together on this, and hopefully, depending on obviously changes in traffic lights and all sorts of different things, we'll be able to do more face-to-face. But we didn't want to go too long without getting your feedback early. And some of the other sessions that we'll run in May will probably focus on each of those areas in a little bit more detail. But what we'll do is open it up, hand it back to Will and open it up. Questions?
Oh, goodness, too clicky on the mouse. Kia ora everyone, don't be shy. Come forward with any open questions. Please just raise your hand, your little Zoom hand, and any questions that are there for the team. Nick, I see you've got a couple on the chat. If you want to make those more verbal, please feel free to do so. And anybody else?
question.
Sure, Peter will love that. So,
We know each other well.
we do know each other very well, really well. So, this is one of the reasons I was keen to be part of it, because I know Pete's got a massive task in his hand. I'm keen to help him and the rest of his colleagues out as much as possible. I guess one of the key things for me is this goes a lot of the stuff I've been hoping we'd get to for years, is that, essentially from what I'm seeing here, Hira is going to be, putting it bluntly, the mother of all data aggregators, which is great. But again, there's a bunch of questions that sort of leap into my mind from a governance point of view in terms of stewardship, which Pete said will get put up in the high level framework, but in terms of data ownership, does the data belong to the digital health consumer? Does it belong to the ministry? Does it belong to the service providers? So working out where that sits, because that will directly influence who owns the risk thresholds and risk criteria as well. I can see there's going to be some really important work done around data classification and tagging in terms of what different sorts of data, and having a common language and taxonomy, so different health providers and healthcare consumers understand what is sensitive and what is not. And I guess one of the key things that, we're already sort of talking about standards, which are great, but one of the things I learned from my time in the health sector is that a lot of our criteria for assessing whether health sector agencies are effective or how effective or secure they should be is based on their size. And I think that's actually a slightly flawed model. I think we should be thinking around the nature of the health data they hold, because some small organizations have potentially quite sensitive holdings of data in terms of, say, pathology labs, you're thinking in terms of radiology organizations. All those sort of organizations hold quite sensitive or data rich holdings. But yet in the wider framework, they've traditionally been glossed over, or NGOs who potentially work at, or public health facing organisations who work in mental health, sexual health, and those sort of organisations, they've traditionally been overlooked because they haven't been large enough, or else they work outside the main centres. So how are we going to effectively provide them resourcing capability to onboard them, and realising the standard is it is uniform and it is universal, which is great. But we need to think of a maturity pathway to help get these organisations up to that level. We can't just sort of drop the heist in front of them saying you will comply, because in many cases, despite the best will in the world, they're not going to have the money to do it. They're not going to have access to the resources and capability to support them to do it, and they're not going to have even if they're potentially stay on the West Coast or more remote areas, their ability to actually access this capability in a meaningful way and demonstrate that level of compliance and maintain it is going to be really challenging. So I think this is an opportunity for a digital, cybersecurity literacy and empowerment conversation, helping these organisations onboard safely, because I don't think there's a lack of will in any stretch of the imagination. It's just the means, and actually wondering what the pipeline should look like to get them there, and making sure they understand that they feel like they're actually included in the conversation and the frame of reference for which their relative importance from a security and privacy point of view is commonly understood. And as I say, getting that common frame of reference of what that looks like, and identity, let's not get started on digital identity, Pete, but what that looks like and how that is managed in a sustainable way is going to be really, really important, I think.
I'll answer that, and that because it's one of our core foundational principles. Everyone's got to be on equal footing on this for Hira. Some of the big players in the health sector, they could easily say, yeah, all the stuff that you've talked about, oh, it's easy, we've done that a million times. But for the small NGOs, those harder clinics, remote communities, never done this before, they don't have spare cash for a PIA or a pen test or anything like that. So that is for me, from a sector engagement approach, that's my focus, is to make sure we bring those organisations on this journey, and sooner rather than later, they're recognising, we had this in the last session, recognising that a lot of big players in the health sector have a lot of capability that actually we could pair you up with others who struggle and need access, need someone to bounce ideas off, because Hira, what we don't want to be is the kind of sole gateway for that, because we'll be overwhelmed. But pairing up organisations with other organisations who can buddy up and help them through this transition period, and recognising that these, at the bar, maybe too high or maybe too low, but we've got to transition them to that so that they can have an equal play with this.
And I think there's a couple. Yeah, there's certainly a couple of things in that space. One of the things I've always wondered, particularly in the vintage connected health space, is whether or not for larger health agencies such as Auckland DHB, Watamatā DHB, Canterbury DHB, whether they can particularly act as local champions or brokers, or effectively kind of help hand up and support and drive and support some of these smaller agencies in their regions to move ahead, actually kind of facilitate and a bit of, you know, pastoral care in that regard. But dare I say it, also, if some agencies haven't quite reached the required security level, maybe we present it so there's different layers of access they have. So they have access to less sensitive information on the basis of the security of a posture. And once they get a more mature posture, then they can be granted access to more sensitive data. So we have more of a granulated access model. So it's not a case of either all or nothing, because working out, giving, you don't want to ever exclude anyone. But in some cases, some of the aspirational targets we're talking about here, say when I think, you know, example here in Dunedin, where I am, some of the smaller GP clinics who may be independent from WellSouth and that sort of stuff, or out in Central Otago, they're mainly in ADSL. Their accessibility to access security professionals is really, really low, but they shouldn't be digitally disadvantaged just because of where they are. So working out what a conversation with Southern DHB looks like to help get them on that way, or WellSouth, could be really useful.
Yeah, definitely. And for Hira, what we're really conscious of is creating all this, you know, ability for consumers to access their data. There's two other issues in that. One is not everyone has got access to connectivity, or B, has a device, or C, can actually use a device from a digital literacy point of view, from a consumers. But also, my other thoughts just got out of my mind. So something else you said there, Nick, but all of those things I think are going to be important for us. It's not just the digital data piece. It's about how do you bring the whole health sector along. And actually, the thoughts from just come back, because also part of our discussion here isn't just about the data. We've got to think wider. You know, when you talk about communities in Murupara or other areas, you know, when you talk about health outcomes to them, it's about heating, it's about food, it's about a whole lot of other things, not just about how can you use this data to make better health decisions. And someone's posted something around personal data too, because, you know, my GP's told me I've got to walk 10,000 steps a day. Why can't I upload my Fitbit to tell them I've done it? You know, so all of those types of things we need to consider, and we need to be broad and open to a much wider discussion.
Questions?
Yeah.
Well, I'm trying to find my unmute button here. Hi. Hey, one of the things that we've learned with a lot of these exchanges, certainly internationally, is if you don't engineer your brand and trust, then you're highly likely to have a really tough change management journey. And I was struck by many of the presentations at Hidden's early in the week, where we have stats like 73% of consumers are very comfortable with their data going up and down the country to every GP, right? And be shared quite freely. I think that dropped down to 13% if the Ministry of Health was to see that data. So it kind of shows you straight out of the gate, we have this trust gap. We've seen it in social services, you know, when the NGOs were very, very reluctant to post their data back up to MSD and social care agencies. So I was just wondering whether you've started to think about what is your brand and the purpose of Hira, and how do you make that a trusted purpose with a trusted brand and real social license? Because it can't be an afterthought after we've just designed whiz-bang technology.
I'll start with that. So the short answer is everybody totally agrees with you. And right from the very beginning, when we developed the business case, we've been talking about consumer engagement and consumer empowerment. And in part, we're talking about their giving access to stuff that either they have or they haven't had in the past, but in a way that they can see how their health information has been used across the health sector. And that the point associated with that is to grow trust from consumers, but also from other providers, to help us then have a conversation around using that information to enable more innovative services that are able to be offered, and or to help develop new and more inclusive services that solve some of these hard problems that we have in different parts of our sector. So trust is a cornerstone or an anchor of what we're doing. And so the stuff that Patrick talked about earlier around the information model, you saw in there, we're not going to lower the bar to make it easy for people to hop across, because we cannot afford ever to lose trust, because getting it back will take forever. What we are looking at doing is helping people to attain the standard so that they can participate, and we can then demonstrate to our consumer parties that we have taken people on the journey to get there. That's the thinking, and that thinking will evolve, and I'm sure others around the table here will have a lot more to contribute than I do with that, but that's the starting. We do not want to lose trust, ever. In fact, I'd probably go so far as to say we probably need to take some steps to actually gain more trust than what we've already got. And we've got people, so Jen, who's not here, Jen with me, who's our Māori Health Director. She's got quite a different view of this information sharing and how it will be used and whole order health, and what does that mean? What does it look like? And I was like, oh, that's quite different. But it all comes back to trust.
Yep. And I think there's also being clear on what our role is in that versus what the system's role is in that. And so, and I think this distinction will be opaque to a lot of people, and it'll be our job to try and make this clearer. But we are not looking to be the people that hold all that data and use it. We're really trying to make sure that we create that plumbing underneath to connect everybody together so that can be used with the consent of the individual. Now, that's a pretty semantic description or semantic answer to your question, Torsten, because it's not us saying, well, technically the ministry doesn't see the data, doesn't change the fact that the data is transiting systems that the ministry controls. But from a philosophical perspective, I think part of what we're trying to make Hira, the lasting legacy of Hira, should be that it exists distinct from the ministry. It's a thing that's owned by the system, that's for the betterment of the system. It happens to be being pushed out, or driven. The pointy end of that wedge is being driven by the ministry or Interim Health New Zealand at the moment, because that's technically where we live. And so how we make that more transparent, I think, is another job we have to do. But I agree with you. We can't. We live and die by the trust that the people have in the system, and we can't realise the consequences of the transformational change. And Hira's definition of being to widespread effect isn't going to happen if we don't have the buy-in from the communities that we're intending to serve. And to your question that you posted in chat, do we have an MVP of the digital rights management? I don't think we've got anything real there. And I certainly that's something that I'm certainly looking to get cracking on very soon. We've got some dedicated expertise we're going to try and bring into that, but that's really part of our job here is to have people who are pushing parts of this forward while partnering with lots of intelligent people who are far more capable than us, who have already done this before. A lot of my methodology, particularly with the information model, is not to start from scratch. I don't want to create anything novel here, and so Rosie's paper, as you mentioned, those are the kind of things we want to start and lift from, and work out how we contextualize that in the context of the Hira Information Service, rather than going, let's do some new stuff. We will have to do it, almost certainly, but that's not a starting position.
Kia ora, Angela.
Kia ora. I've spoken to you before briefly. So I work in the sexual violence sector, and I think one of the things that's been raised, and I've had an organisation also approach me to indicate an interest in liaising with you, was around health data that was essentially medico-legal data, and what considerations have been had already around when there is health data which is part of criminal investigations, for example, MedSAC, who are the clinicians who do forensic examinations for sexual assault victims, and the healthcare for people who have experienced non-fatal strangulation or suffocation. Has there been much fielding of scoping out of what the intersection of that data might look like?
So I think the short answer to that is we're aware of those kinds of concerns, but we haven't yet had anywhere near the amount of time to consider them properly. And it's the kind of thing that I'd love to be connected with people exactly in that space, so that we can understand the intricacies of that. There's there's a real kind of, I guess, a conflict here in the sense that we might create, there's lots of information that we could make available. Just making it available has really, really unintended consequences, even if it is owned by the person, even if it is that person's information. And we've got some really tough questions to ask ourselves. And I mean ourselves in the royalist of senses, not ourselves within the program team, about how do we do that? And I think that the kinds of things that you mentioned there, there's some real value in having some of that information available, but there's also some significant harm that can come from that. I think there was another question that was posted in the chat about how we control how consumers have access to to different pieces of their information. And I think we're going to need to come up with, and again, we in the broadest of senses are going to need to come up with what's that default position, because a lot of the surveys and things that we've done to date have sort of said consumers really want to feel that control. They want to be able to say yes, who has access to my data and who doesn't. But then when you ask them the question of how would you manage it, most of them go, I probably wouldn't. And so there's going to be a lot of work we need to do on defaults and default positions, because people's risk tolerance will be different. But what are those sensible starting positions, and then how do we define those, and in the different contexts because mental health is another section that's quite difficult to contextualize. And I think sexual health, particularly with young people, if you've got a parent that wants to see that information, how do we manage those kinds of questions? So I think the answer to your question is it's very complicated. We're aware of the complexity, at least in part, and we need to do a lot more work to do the definition.
And we'll be linking back with you, Angelo.
Yes,
Thank you.
of course. Yeah.
Can I just pick up on Kath's question from before? So within the program, and Patrick's alluded to this, we have a deliverable around consumer sharing capability, and that's a key to transparency and trust. And so we want to engage appropriately and at the right times to actually develop that. It's also a capability, I think, that will evolve over time. I think that initially we probably all want to take a conservative view to Patrick's defaults, and as we learn, then there's opportunities for introducing additional sharing complexities. But the problem with sharing is it's so complex across our existing system. There are so many actors, so many players, so many systems, so many this, that, and the next thing, that I think we have to take baby steps in that. But we have to take steps, and that's the point that we're trying to say in the program, is that we will begin somewhere. We won't let, what was a comment that was made earlier, we won't let perfect get in the way of good enough. We've got to start, obviously with our eyes open.
And there's a transition too. I think we would, a lot of the work that we've done in the early days kind of looks at what that magical future state's going to be, and it's and you can talk about that quite conceptually, and it feels really nice and fuzzy when you do, but then you start thinking about, well, how do you do that? How do you do that transition? How do you go from where we currently are to that future state? Because it's not going to happen overnight, and especially when there's education involved, and consumers need to be taken along as part of that to have, because for a lot of them, I'm sure they don't even think about the fact that the health system has data on them and on a daily basis, and how do we bring that to the front of mind? And so there's a lot of work we have to do there, and that's why I think I wholeheartedly support, endorse what Pete's saying in terms of iteration. We've got to take an iterative approach to this, and what we're doing now might not be the thing we're doing in 5 years' time, but it might be a necessary step to set the foundation for that 5-year time future.
Yeah, I think Patrick, just building on that consumer side of things as well, it very much goes for healthcare professionals as well across the whole of the health workforce. So there needs to be that sort of consideration of them and how they will use the systems and the data and so on and so forth too, and how do we build and how do we teach them, and how do we, within this program, because if they get left behind, then the whole program gets left behind. So what's the sort of consideration around that?
To Nick's point in the chat, I think absolutely that's a real risk. And I think the other thing is too, there probably isn't one answer to that question either. There are going to be different cohorts and different people that have much different views about how they think about their information. I think a charter, I'd love to talk about a charter like that. That seems like a really useful instrument that we can use. But I think we also need to be aware that our audience is everybody, but we're also going to struggle to solve everything for everybody. So how do we? And we can't necessarily also take a lowest common denominator approach to this. We can't take the position of some of the people with the most sensitive approaches to health data and apply that across everybody, because otherwise I think we'll probably find ourselves artificially limited by that. But by the same token, we then can't consider and dismiss those people's concerns as not being real, because they absolutely are.
So there's a couple of elements in that. One we were actually just talking about today, when I look at a labs report or something like that comes through, Google helps me explain what it means. And we need to create the ability for a translation service between the clinical component and actually what consumers, what's it to a consumer, and how do they take that information and use it to make any decisions with themselves or whānau or whoever. So I think we've got to make sure that we don't create a technical, clinical view only of the data that we pull together, but we've got to make it real. The other thing is also our engagement component is going to be really key, because what may work for us in the room, virtual room, may not work for Māori Pacifica, may not work for the Asian community, the wider Asian community. So we've got to make sure that we bring consumers and they help us co-design this, because yes, we're putting the foundational pieces in place, but we're actually also engaging out in the community, because things like my story to a consumer is far than a labs report. And not having to repeat myself every time I go see a new person in the health sector who doesn't understand or can't access my records, and I have to explain my disability or anything else. So having, for us, it's not just about the data, it's got to be usable and it's got to be contextual, and making sure that people are able to update their story and it reflects, so that the 15 minutes you're with the GP, 12 minutes of that's not wasted on a rendition of your previous history, because your GP is not there for the day. So I think we've got to think about the engagement with the wider community quite differently, and making sure that they help design what Hira means for them, as well as bringing ones like yourselves on this journey around the data that you hold or the data you could consume as well.
Yeah, definitely getting rid of those repetitive stories would be a fabulous thing, wouldn't it? So
it would. Yeah. It's an interesting one. I think one of the things that we also are very conscious of is there's no such thing as a typical New Zealander. And I've been on this Hira journey for a wee while now. And as part of it, I've been testing it with my friends and whānau. And my mother's view is, that digital thing, I don't need any of that, dear. You'll just look after it for me like you always have. All the way through to the, why the hell don't I have full access to this? Some of my nephews. I want to control everything, and I know I don't want to share any of it. So, there is no, I don't think there's a typical person here, and we've got to cater for all those personas, and it's going to be challenging. And I think that one of the things that we're trying to make clear is that we are on a journey, and that journey doesn't have a destination. We're going to evolve this over time, and this needs to be a transformation. So Hira is about changing our attitudes, about helping healthcare delivery in New Zealand's attitudes change, helping health consumers be more engaged and participatory, if they want to be, and making health accessible to them. And this is going to take a long time to get there. So I think that we've got to be ambitious, we've got to be audacious, we've got to get going. But I don't know that there is necessarily a destination that will turn up in 3 years, or turn up in 5 years. There'll be certainly things that we've delivered, and there will still be people who'll be disappointed, and there'll be others who'll be overjoyed. So I think that's part of the story that we've got to weave into this as well.
And I think we also need to be aware that digital means might not be the only answer. We have to make sure that we cater for people who may not want to interact with the system in a digital manner.
And so just before I go to Nick, and now the point we're talking about all New Zealanders. So that includes all of those Kiwis who don't live in New Zealand. Because they all have records that
Anyone.
they want to access, that they want to take to their GP in England or wherever they are in the US. We've got to make sure that it's inclusive for all Kiwis who are eligible. So, Nick.
Yeah, I mean, I guess one of the key things thinking about this is further and further is, you know, I think it's going to be really, really important for us to be really transparent and clear about what Hira is and is not, because I think that's going to be a key differentiator in the stewardship data responsibility space, because one of the things that we're unfortunately guilty of in the sector is, you know, I'll call it like it is throwing rocks to the ministry when it suits us, when things don't quite go our way or things aren't happy, and actually understanding that, you know, Hira it's like a bus. It takes you from A to B. It's a means to an end. It's not the end in of itself. So being really clear around that, because I think that's going to be really important for having various different sector players, whether they be technology and service providers or health agencies, step up and take a bit more responsibility and accountability for their own management of the data, and actually in terms of how they manage and look after it as well. And I mean, increasingly listen to this, I think, you know, things like having a classification standard to a certain extent, or potentially around impact and risk for various different data types. Yes, that will be challenging, but I think that's going to be a really useful place to start. So we've got a common operating model, because when we look, as you say, we talk about risk-based approach and that sort of thing. Well, if we understand at least some degree of commonality, particularly when you start talking around to digital consumers, because they're not going to necessarily care whether this is, you know, enriched data XYZ, but this is data around what my 16-year-old daughter is doing or what I have been to see my oncologist about, and we can present it in that way and saying, you know, that's going to be really important, because obviously the relative risk and impact and criticality, that's not ultimately determined by us, that's determined by the people whose data it is about. So it's how we tell that story. And I think so that classification conversation and the narrative and labels that go around that are going to be really, really important within the engagement process, and also in terms of how we actually engineer, architect, design the whole capability, because we need to hang off that as we tag those various different parts of data as well.
Is there anybody else with any burning questions that they want answered from the floor? Don't be shy. Do come forward. It's your opportunity to have a chat with the team.
Maybe while people are pondering, there was a question in the chat from Simon about the sort of focus of data, and obviously we've talked a lot about clinical data sets, and Peter's provided an answer that I think is something we need to do a better job of in terms of descriptions as well. But you know, our data sets need to include things beyond that contribute to health and well-being in a general sense. How far we go with that is a really, to Nick's point before, we've got to be careful we don't try and boil the ocean with all of the data sets we could ever possibly do that could possibly relate to health, because at some point you're going to start doing things that the Ministry of Housing are doing. But we also need to be conscious that this isn't just, you know, the determinants of health are not just things that you do in a clinical context. But the other point I was going to make too is that the information model that we need to be created for Hira isn't something we're creating that is Hira's exclusively. And I'd really like to see a situation, and I'm trying to work, I intend to work to this outcome where, you know, we might establish the first version of it, but we want it to be owned and continue to operate, you know, outside and beyond the scope of what Hira is looking at solving. And so if in the future we want to extend that to include definitions and standards around interoperability for health workforce management, payroll, rostering, credentialing, all those kinds of things, then like absolutely that's something we would look at. Whether it's for us to do or whether we find, you know, we create an environment where others can extend it, I think that comes down to whether we've got the money and the funding to do it from Treasury, but I don't think that should inhibit the outcome.
Awesome. That's awesome. Anybody else? Silence.
So you can still email us on the email address. We'll send out the slides so you can have access and you can have a little think about it. And, you know, things like our principles, our objectives, all of those things, you know, feedback on it. We had an earlier one that a few suggested that we add in, which is great. So let us know your thoughts, and we'll add those onto our next iteration.
Yeah, well, thanks, team. I just like to say thank you very much. Once again, this is our second for the day, and we've got more. And I just really appreciate the Hira team being really open and here and available to answer your questions. I know that you've the industry have been wanting to talk to you for quite some time, so this is a really good forum to be able to do this. We will look at face-to-face at some point once these COVID restrictions allow, and I'm sure there'll be lots of chatter and banter then anyway. It's a bit harder on Zoom, but we really appreciate you all coming. And as Sandra has said, there is always the opportunity to talk to any one of the team here that you can see. So that's Becky, Vidya, Patrick, Sandra and Peter, and their doors are open, and we are willing to help facilitate that. So we'd just like to say thank you to everybody here, and I'd also like to make a special mention to Megan Dinny, who's helped set up this event, and Liam, who's my operations manager, who's been working in the technical side in the background. And yeah, keep the questions coming. Don't stop with the questions, and then we'll end up with a whole big portfolio of answers for you eventually, won't we? So fantastic. Thanks again for another great workshop.
Kia kite.
Thanks, everyone.